This segment sponsored by Femme Medical Spa.
Welcome to Women's Health Wednesday with Femme Medical Spa. Now you're probably wondering, what do I have in my hand? Well, these are surgical tools and we're going to get an exclusive look at how they work. These tools help minimize fibroids and so much more. I am so thrilled to speak with Dr. Ashley Scott as she walks us through the procedure. Let's do it. I'm now joined by Dr. Ashley Scott, who is a certified OBGYN and also the owner here at Femme Medical Spa. Hey there, Dr. Ashley.
Hello.
Good to see you.
You too.
Okay, so you set up something so cool for us. In a previous Women's Health Wednesday, we dove into the topic of fibroids.
Yes.
Right? It's a big mystery because a lot of people don't really understand it or how it works. So start off by giving us an overview of fibroids and how women can be impacted by them.
Okay, so fibroids again are benign masses, one of the most common tumors in the world. It's an overgrowth of normal fibroid tissue. And so it causes increased bleeding, pelvic pain, urinary frequency or incontinence, and just a disruption to a lot of women's lives.
Right.
And just a fun fact, it takes women on average about 3.5 years before they start to seek treatment for their fibroids. So that's a long time to be suffering.
That is, and I think part of the problem is that the education isn't out there. People don't know what it is. It's not talked about in families. It's not a normal thing.
Yes, and a lot of women assume that, oh no, either it's normal or I'm gonna have to get a hysterectomy and I don't want that, so I'm not gonna do anything. But here today, I wanted to discuss a lot of the minimally invasive options that are out there for women.
Yes, and it's so cool, this little simulation that you set up.
Yes,
okay,
yes.
so let's start here. Okay. What is this that we're looking at?
So this is radiofrequency ablation of fibroids, or a SESA.
Okay.
So this is probably one of my favorite surgeries to perform, so you get to scrub in with me today.
Okay, I'm excited.
Now what I love about this surgery is it's like a three-dimensional surgery. So we have a laparoscopic camera, which this is represented here, and so we can see, laparoscopically what's happening.
Okay, let's break down a couple of things first. What is this?
So, so this is your uterus. So this is the cervix here. This is as if this is the patient's head on this side and their feet are down there. This is the top part of the uterus. And so you can feel in here, the fibroids and how they feel. They're very firm masses, almost like a baseball consistency.
Okay, so cervix and then up.
Top
and this
part
is
of the
typically,
uterus.
So I know that you had mentioned before that fibroids can live in different areas of the body. So this would be in the internal line?
Yes, so these would be what we call intramural. So they're inside that musculature of the uterus.
Okay, so they feel like little stress balls, honestly, like those little pushy squishies.
Yes, or actually right here, like you're feeling normal tissue around it, and but when you feel the actual fibroid, it's very firm.
Okay, so this procedure here is going to essentially show us how you can minimize the fibroid without going in for full surgery.
Yes, so this will shrink the size of the fibroid, it'll destroy the blood supply to it, so you can get symptom relief without a big major surgery. Okay, so what this is a laparoscopic ultrasound. This is our window here. It goes in, and we have a screen on this side that is showing me on an ultrasound view what exactly I'm looking at.
Now, when you say go in, what location is this on the body?
Thank you. So we have 2 incisions on the abdomen. There's one that's going to be in the belly button, so this would be represented here.
Okay.
And then there would be another incision in the bikini line. And so let's say it doesn't matter if you put your laparoscopic camera in the belly button or the bikini line, but so long as you have both port sites so you can access your instruments.
Okay, so this is the camera. Okay.
So this is the camera here. That's what's representing our laparoscopic camera. And this is our ultrasound probe. So now on my ultrasound probe, just like the ultrasounds you get in the office, and we are able to locate fibroids, I can now do this laparoscopically.
Okay.
So I'm abutting the the ultrasound probe immediately against the uterus here, and I can see it on my screen here.
Right.
And now I know, exactly what I need to treat. So this is our handpiece, and this is where the radiofrequency energy is going to be emitted from. So this, we just make like a very tiny little incision on the abdomen, and I would guide this handpiece in, And so I can see on my laparoscopic camera exactly what's happening, and I can see on my ultrasound camera what's happening. And so I am looking for my fibroid, which I have here. And so I don't know if you can appreciate it on that screen, but you can see it to start to come into view.
Right.
And I always want to make sure my ultrasound probe is immediately against the tissue. And so as I'm coming into the fibroid, now I can pierce the tissue into the uterus, and I'm going to keep guiding my needle, or I'm sorry, my handpiece into the fibroid. And so now once I feel like I am confident that I'm not, you know, next to any other major organs like your bowel or your intestines or your bladder, now I'm ready to actually activate this. So we'll use this handpiece.
Okay.
I'll deploy, there's lots of tiny little needles inside of this. We deploy it, and then we would activate it. So what you would see laparoscopically is on the uterus itself, you'll see the color start to change. It'll go from a pinkish color to white. And that's what'll tell me, okay, this is actually destroying that fibroid. And then on ultrasound, the fibroid appears gray at first, but when it turns white, then that tells me, okay, that part of the fibroid is treated. And so this is a procedure that we would repeat until all of the fibroids have been treated.
Wow.
And so one thing about this is even the tiniest of fibroids when I'm doing the surgery, so even if they're just like a millimeter or a half a centimeter, I absolutely want to treat those too. Because they're not a problem now, but they have the potential to become a problem. So this is a very safe surgery. The other benefit to it is it's a very fast recovery time.
Really? Yeah.
So,
what is the recovery? Because they look like very small incisions.
Yes. So the recovery time is about 4 to 5 days on average. But I would say at most maybe about a week or 2.
Really?
Yes, and this is very different from a hysterectomy where you need at least 6 to 8 weeks of recovery time. So this is great for like moms who have busy lives, maybe you have a very busy, demanding career, and you just can't afford a lot of downtime.
Because in the past, before this innovation, people had to have actually incision surgery, right, to get in there.
And we would go in and we would physically remove the fibroid in a procedure called a myomectomy. It's a lot more uncomfortable, a lot more pain. With this, more often than not, I'm just prescribing Tylenol and ibuprofen.
I love that. Okay, well, you said I get a scrub in, and this is going to be like Grey's Anatomy. So
absolutely.
Let's try it out.
Okay, yes, you scrub in.
Scrub in.
We got our gloves on. You're going to pick up that ultrasound probe first. And you can kind of cheat this. You can feel to see which fibroid you want to go after.
Okay, so first put this down like that. And you say put it up against, and boom, that's going to give me my imaging.
Yes, so you see your fibroid is starting to come into view.
Yes,
but now you see how you can't see all of it. So if you insert this just a little deeper into the pelvis here.
Like push it up?
Yeah, push it down.
Oh.
Now you see the whole thing.
Oh, wow. And this is why it's so important for surgeons like yourself to have steady hands, because you're doing a lot. Okay, so then I can go after, I can do a little incision here.
Yep.
Ooh, okay.
And so now as it's coming in, I can see laparoscopically, but now you want to make sure, okay, so you see your fibroid.
Okay.
So you want to, this is like where video games come into play.
Right.
Now you want to direct this handpiece so that it is inserting into your fibroid. So actually, you want to move closer to your ultrasound probe.
Okay. So maybe it's there.
Yep. And so you see how it's coming in down there. And now you're getting the fibroid, but you're on the you're kind of like in the posterior end of it. But that's okay, because sometimes you can treat each individual fibroid more than once. So if you were to activate there,
okay, now push down.
What you would do, you take your thumb, you push down, and that's deploying lots of tiny little needles. So it opens up an array of treatment field, and it's tough. But you see this yellow here?
Yes.
That's your zone of treatment.
I did it.
So that's exactly what would be being ablated if we were to actually activate this.
Incredible.
Yes.
A lot of moving pieces, amazing technology. And so let's continue to move down.
Okay.
So you also have other devices here that treat it in a lesser invasive way, if you will.
Yes.
Right?
So this is also from Hologic. This is what we do in office. So we're using a hysteroscope. different from a laparoscope. I'm not making any incisions on the abdomen. I'm going through the vagina.
Is this outpatient care?
This is outpatient, yes.
Okay.
This you can do in the hospital or you can do it in the office.
Very nice. Okay.
So we're going to pretend like this is our uterus. This is our hysteroscope. So it's a camera that I can use vaginally. So we're going to pretend like we're going through the vagina, into the cervix, advancing into the uterus. I can see, this is our pepper, but we're going to pretend like it's a polyp. And I can see that tissue that I want to remove. So I have my instrument here.
Oh, wow.
It's like a grasper, and I can grasp at the tissue. And still I'm doing this upside down. But, you know, we can remove it.
Oh, you got it. That little bitty piece.
And that's what I would send off to pathology.
Wow.
Yes.
Okay, so tell me the difference in this treatment versus this treatment.
So this treatment, even less downtime, maybe a day or two. This is for pathology that is on the inside cavity of the uterus, whereas this is for pathology that is really kind of anywhere in the uterus, but primarily in the musculature layer.
And to be clear, pathology is a fibroid?
That's the fibroid.
Okay.
It could be a fibroid, it could be a polyp. This also can be used for any source of abnormal bleeding.
What about cyst?
So if you have a cyst, you'd want to do something more laparoscopic because that would be outside of the uterus.
Okay, gotcha.
Now,
Okay.
other fun things that we have.
Yes.
This is an ablation device.
Okay.
So for women who are suffering from heavy irregular bleeding and they want a faster resolution as opposed to being on some kind of medical therapy,
Okay.
we can use this. This is called our NovaSure endometrial ablation. This is for heavy bleeding, irregular bleeding, you know, just bleeding that is a nuisance.
And it goes in, sucks the bleeding?
It goes into the uterine cavity. So if this is our uterus, it advances into the cavity, and once it's in, we activate it. It deploys. The uterine endometrial lining sucks onto this, and when we activate it, it starts to ablate that tissue. So the ablation time is anywhere from 30 seconds to 2 minutes.
Which means it seals it.
It doesn't necessarily seal it. We're destroying that lining and we're destroying the blood vessels. So you're burning that tissue. And in doing so, you're deactivating it. So now it's not going to be responsive to those hormone surges that you get every month.
Which causes the bleeding.
That
Now,
causes
is
the
this
bleeding.
similar to a root canal? Just to place a similarity where you're going in, you're killing the nerve so that the filling is no longer there to create decay.
Except we are destroying that lining that actually is, you're shedding every month. Now by destroying it, I can prevent that process from happening.
Okay, so it severs it. Okay,
Yes.
got it.
So essentially what we say is 98% of women who get this treatment have satisfaction with it, and about half of them have no period at all. So they achieve what we call amenorrhea, which is no bleeding.
Which I think that's a lot of women's goals is to stop bleeding, but this isn't for everyone. This isn't
It's not for everyone. So you need to have a certain size uterus because this fan can only expand so much.
Okay.
But the other thing is you want to make sure you're done with your childbearing years. You don't want to get pregnant if you've had this procedure done.
Okay.
Yes.
So maybe perimenopause.
Perimenopause is great, or you know, you just know that you don't want to have kids and you're like later in life and you're ready for a more permanent solution. This is the treatment for you.
And what makes this so innovative is that this is a alternative option to a hysterectomy, right?
Absolutely. Alternative to hysterectomy and alternative to hormonal contraception. A lot of women love it.
Yeah. Okay. Well, this is awesome. Oh my goodness. And so these are procedures that you offer here at Femme Medical and Spa.
Yes, in the office.
Okay. And people just really need to come in and have a consult, bring you on as their OBGYN so that they can discuss these options and just see where they're at, right?
Absolutely.
All right, awesome. Thank you so much,
Thank
Dr.
you.
Scott. And if you would like more information about Femme Medical and Spa, we'll have their website listed below. You can book a consultation to see if these procedures are a right fit for you or so many other things that they can recommend. And I'll see you after the break.
This segment sponsored by Femme Medical and Spa.